Case number 14. 1 minute for you.
Okay, I can start.
Okay, enter please.
Good afternoon, Mr. Hassan. It's me, Dr. Rashid. How can I help you today?
Good afternoon, doctor. Doctor, uh, I'm a patient of cancer, doctor, lung cancer. And 2 months ago, doctor, it was detected. And I am now taking some medicine by my cancer doctor. But I am here, doctor, to talk about my back pain, doctor, and it is becoming troublesome, doctor, more for last 1 week, doctor. So I am here, doctor, to get some treatment for these, doctor.
Okay, okay. Mr. Hassan, I'm so sorry to hear about your lung cancer, and you are getting treatment. That's good. Now you told me that you have a back pain for last 1 week, right?
Yeah, doctor.
Okay. So can you tell me a little bit more about your back pain, how this started?
Suddenly, doctor, one day I was just going to my washroom, doctor.
Uh-huh.
That time I feel pain, and when I was using my washroom, it becomes more, doctor, when I sit on the fan.
Mm-hmm.
After that, I came back, doctor, and I took some paracetamol tablet, 2 tablets together.
Okay.
But I'm sorry that, doctor, my pain is not relieved. And day by day, doctor, it is becoming more.
Okay, okay, okay. And you told me how this all started. Did you had any injury or you fell down? Anything like this happened before that started?
No, doctor.
Okay, okay. And Mr. Hassan, can you scale this pain for me? Like if I say 1 is the minimal pain and 10 is the maximum which you cannot tolerate at all. So how is this pain?
It's five, doctor, around.
5. Okay, so I can see you are in much pain. Are you comfortable to speak right now, Mr. Hassan, or you want to lie down?
No, no, doctor. Thank you. I can talk to you now. Though I have a little pain, I'm feeling now.
Okay, okay,
It's
okay.
okay, doctor. Thank you, doctor.
Oh,
Thank you.
okay, welcome. Okay, Mr. Hassan, this is in your lower back. So, is it going to your legs?
I couldn't observe, doctor.
You couldn't observe. Okay, and any other joint of your body, are you feeling any pains?
No, doctor. No.
No, okay. And this in your legs, do you feel any change in sensation, like any pins and needle?
I feel a little uneasiness, doctor, but I don't know what is this.
Okay, okay. And Mr. Hassan, is there anything which makes it worse?
Actually, if I move, doctor, it becomes more.
It becomes more. And how it gets better?
Actually, doctor, nothing giving me, doctor, better feeling.
Okay, okay. And for last 1 week, you are using only paracetamol.
Yeah, doctor.
Okay, okay. Mr. Hassan, is this pain giving you problem at night, like your sleep?
Yes, doctor. At the night also, I am having pain, doctor.
It's affecting your sleep.
Yeah.
Okay, okay. I can understand. Okay, and how is the things like you can walk to the toilet now independently, or you have to take some support?
Yeah, doctor is very sad, doctor. Last few days, doctor, I feel weak, doctor, to go to my washroom now. In the last 2 3 days, doctor.
You have to take support.
Yeah, doctor.
Okay, okay. And who lives with you at home?
My wife, doctor.
Okay, she's supportive for you.
Yeah, yeah, doctor.
That's good. That's good. Okay. Mr. Hassan, apart from this back pain, do you have any other issues to speak today?
No, no, doctor. That's all about my back pain, doctor.
Okay, okay. Mr. Hassan, did you ever feel that while passing urine, any problem while passing water? Is there any problem?
Till now, doctor, I don't have trouble, doctor.
You
But
don't have any.
I cannot go to the washroom myself. Is the problem.
Yeah, I understand. And that area around your that part of the body around your this thing lower parts, lower back. Is there any change in sensation? Any
That's the pain, doctor, only.
only pain? Okay, fine. Okay, Mr. Hassan, what do you think? What is going on?
I don't know, doctor. Maybe some bone damage, doctor, in my back. Because when
Mm-hmm.
I touch my back also by the finger, I feel something wrong there, doctor.
Okay, Mr. Hassan, we'll check that. When you are walking, do you feel that you are a little bit bending, or your wife noticed any change in posture?
Really, I have to move my body in different position, doctor. I try to minimize my pain, but no
Okay,
position also giving me relief, doctor.
okay, I understand. Do you have any particular worry?
No, that is the thing, doctor. The bone,
Okay,
I think,
yeah, I understand.
the damage, doctor. So I need some maybe treatment for the bones as well.
Okay, we'll check it. Mr. Hassan, I want to examine you. Is it
Yes,
okay?
please, doctor.
Okay, I can
What do you
see
like
your
to do?
blood. I can see your blood pressure is okay, your pulse is okay, and I will sanitize my hand. And first of all, I will inspect your back specifically, the lower back,
Inspection,
and
nothing wrong there.
okay. And then I want to palpate your vertebra, this lumbar vertebra, and for any tenderness, and
The tender
for
area in the vertebra number 11, thoracic 11.
thoracic 11. Okay, and I want to palpate your paraspinal area as well, and
Paraspinal area is not tender.
not tender. And Mr. Hassan, I want you to do some movements if it is possible for you. But if at any time you feel pain, please let me know. Okay, so I want you to bend forward, like for the flexion. Is it possible for you?
I can try, doctor. I can try. Let me check. Sorry, doctor. I feel I cannot do, doctor, much.
Okay, it's okay, please. Okay, is it possible for you to do other movements which I tell you, or you are in pain, you don't want to do?
Actually, what you want to do to me?
I just want to backward, just to bend backward and to sidewise.
I'm
That
sorry, doctor. Possibly I cannot do at all.
okay, no problem, Mr. Asan. You can lie down on the couch. Is it
Okay.
okay?
Okay, doctor. Thank you.
Okay, and can you please expose your shirt,
Okay.
and I want to check the sensation in your lower part of the tummy as well as your thighs and leg. Okay,
Okay,
so
doctor. What do you like to do now there?
okay, so I will check the sensory levels. I will just put this I have this cotton wool with me, and you just see it feels like this. I'm touching on your hand, and wherever you feel, please tell me. Okay.
Okay.
So I want to check the sensory level and sensation in the legs and your lower tummy. So
Okay.
it's
There
all
is actual,
sensations.
yes, in the full lower limb, there is absence of sensation.
Which lower limb?
Lower
Both.
limb absence of both lower
Both.
limb, both lower limb.
Okay. And I'm just trying
Two
to
minutes
check the,
left. 2 minutes left.
okay, I'm just trying to check the power of your legs.
Power is reduced bilaterally. It is
Reduced.
3/5 and 4/5.
Okay. Thank you very much, Mr. Hassan, for the examination. Mr. Hassan, actually, I checked and I discussed this all with you. It looks to me something serious. As you said that you feel some bone problem going on, so I think you are right, and I'm suggesting you to send you to the emergency department immediately. Is it okay for you?
Yeah, why not, doctor? But what serious you are thinking, doctor?
I'm thinking your back, these bones on our back, we call it this vertebra. So maybe some spinal compression, maybe some fracture or something like this happened there in your backbone. Okay.
Okay.
So that is the reason I'm sending you immediately. You need, they will do some imaging there. Okay. To check what is it. And I will speak to a neurosurgeon there, and a spine surgeon. They can see you in the emergency. Is it okay?
Okay, doctor. Okay,
Your
but
wife is here. Can I speak to her and I can explain her as well about this all?
no, doctor. She will come after half an hour here.
Okay, you can give me number. I will speak to her and I can explain her what is going on, and
Yes,
I'll arrange
doctor.
ambulance and I'm sending you to the emergency with the nurse. Is it okay?
Doctor, is it too much emergency, doctor? I need to go right now.
Yeah, Mr. Hassan, I think it's something serious going on and you are already cancer patient. So we need to check it immediately. Is it okay for you?
Okay, doctor. But can you give me any painkiller medicine, doctor, right
Sure,
now?
sure, sure. I will give you right now paracetamol 1 gram injection,
Thank
as
you,
it is
doctor.
not
Time
giving
up.
you
Time
allergy.
up, doctor. Time
Okay,
up.
thank you very much.
Uh, so, Dr. Rashid, I need to talk from end to the front, beginning. Will you think that the paracetamol can give the relief of this malignant deposit pain there?
Because in clinic, I don't think so. We will be having morphine or tramadol. That's why I said only
You
paracetamol.
can use another NSAID.
Mm-hmm.
Another NSAID, suppose injection diclofenac or other, is not available in your chamber, or you can
Actually,
arrange take from the
actually,
pharmacy.
here what I was thinking it should be tramadol or morphine, but NS said I didn't think at all.
Why you couldn't think? Painkiller medicine, paracetamol or NSAID is the wrong one. World Health Organization. So patient
Mm-hmm.
already told that paracetamol was taken before, but pain
Mm-hmm.
was not relieved. So again, though you like to give parenteral injection, even then in the
Mm-hmm.
cancer pain usually relieved by the morphine.
Yeah, yeah,
As
yeah.
in the GP center, you are not giving. Minimum choose some a little different powerful painkiller than the paracetamol.
Okay,
It
okay,
would be a good decision one.
okay.
Secondly, in the examination part,
Mm-hmm.
now I like to say, you are telling that, yeah, Mr. Hassan, I think that there is something serious because you have this. It's very good to explain that you have this thing. But when you are telling that something serious, is it not a little breaking bad news?
Hmm.
What will be our attitude? If we want to give a breaking bad news, we have to give some pause.
Mm-hmm.
But I don't like to tell that much pause we utilize in our special breaking bad news case. But in this
Mm-hmm.
case, after telling the something serious, 2-3 seconds, observe the patient. What is the reaction newly
Mm-hmm.
developing in the patient?
Mm-hmm.
Patient may think that possibly patient will die today because he has the lung cancer. But that this is the art. How to say it? Mr. Hassan, whatever I understood by talk and by examining your part, I am thinking there is something serious. Okay, Dr. Rashid,
Yeah, yeah.
this pause is important.
Mm-hmm.
So, what we can do? We can do that the reverse explanation earlier. Then you are telling the summary. This is serious. Do you understand my point? That I understood that you have some pain and there is some leg weakness and the problem of sensation and other. For that, I am thinking, Mr. Assam, that the condition now is serious. Clear? So you don't need to explain later also that why serious. Do you understand my point?
Yeah, yeah. I understand that
You
first to
start
explain and then
explain
to tell
then the
him that it's
summary.
serious.
Yes,
Right.
tell summary later because you need to show some idea that you know how to give a bad news.
Okay, okay.
This is the observation here. And the examination part, especially to identify the upper motor neuron lesion, core feature is jacks and the reflex, plantar reflex. You didn't do it.
What, doctor? I didn't get. Sorry.
Jacks, knee jack, ankle jack, plantar response.
Okay, reflexes, you mean?
Yes.
Okay, so I should have done the knee jerk
Neurology,
and plantar.
neurology examination is sensory examination at the last.
Okay.
But you didn't go, you start with the weakness, motor power and other, but
Mm-hmm.
jump to the sensory. In between, there is something else.
Okay, okay.
Okay, now suppose that the sensation and other. But what the core feature in the upper motor neuron sign is the plantar extensor.
Right.
Now, if you don't have time, suppose
Mhm. Mm-hmm.
Even you don't need to identify the sensory level as well.
Okay.
Just to
Okay.
identify in this case that is there any features of the upper motor neuron lesion? Where is the lesion? Lesion is in the back in the spinal cord, evidenced by plantar extensor. One examination is enough here because
Okay.
you are not dealing the case because it will be very special case for the neurosurgeon or a spinal surgeon.
Mm-hmm.
Just to identify there is a chance that cord compression is there. For the
Okay.
complete neurologic examination also not important here.
Okay.
The core feature of myelopathy is plantar extensor.
Okay.
So
Okay.
you start with the plantar extensor. Even no need to check the limb weakness also because patient was telling that patient needs some support to go to the washroom. You already got some idea beforehand.
Okay. Okay.
But what about the plantar extensor? Without examination, we never get it.
Right.
So the plantar extensor is the core feature. You missed it.
Mm-hmm.
And
Right.
the
Right.
palpation of the vertebra, you didn't ask that. Where is your pain here? Right?
Mm.
Identify that. So you have to alert that I will not give you more pain.
Mm-hmm.
And if I give any trouble, please let me know. I will take care.
Okay. Okay. Okay.
Assurance. Otherwise,
Mm-hmm.
patient will be aware that you are pressing there. So what you
Mm-hmm.
like to do, this is the instruction, especially in the painful area.
Mm-hmm.
Right? It's not it in the abdomen, anywhere. We need to touch the painful area later.
Right.
But
Mm.
here actually you will touch directly to the painful area. So it is more important to explain that I am touching only. If you feel any more discomfort, I will take care.
Okay. Okay.
Right. And lower, anyway, there was a slip of tongue, I understood. One time you told that I am examining the hand.
No hands in this case. I didn't
Yes,
examine
yes,
your
yes. I have written here. It is
doctor,
slip
but
of
I
tongue.
want to ask one
It is
question.
written. It is slip of tongue. Examiner understood. No problem.
Maybe.
Understand. Second, spinal compression. Ambiguous to the patient. Spinal compression.
Uh-huh.
What is the meaning of a spinal compression to the patient? You
No, I
can
was
tell that
trying to explain, but I was not getting proper words that
rather
your
to say the cord,
backbones,
cord. It is called the cord. Cord
cord
compression, not a
compression.
spinal or you can say
But
only
how we
cord.
will tell the patient?
There is a nerve cord there, nerve
Uh-huh.
cord, and it is compressed by your bone, I am thinking.
Oh,
And it is possibly
okay.
due to your cancer spread.
Uh-huh.
Right. And another one, the imaging.
Uh-huh.
They will do some imaging.
Uh-huh.
Rather to say, they will do some scanning.
Scanning.
Scanning,
Okay. Okay.
scanning,
Not imaging.
not
Oh,
imaging.
okay.
In the very first, and all of you for that, not for the Dr. Rashid. Uh, good morning, such and such. I am here. How can I help you? I think that it seems to be more artificial. I like to say now, just to
Yeah,
make
yeah.
you more perfect. Hello,
Uh-huh.
Miss. Hello, Mr. Hassan. I am Dr. Rashid. I am here. How can I help? It's very artificial in my ear.
Yeah, yeah.
So make it a little more lively. Hello, Mr. Hassan. Good morning. I am Dr. Rashid. How can I help you? Can you repeat, Dr. Rashid?
Good morning, Mr. Hassan.
Good morning. So wait, let your patient reply of your good morning. You are telling like a machine. Please
Yeah, I
repeat, please.
understand.
Repeat, please.
Yeah, good morning, Mr. Hassan.
Good morning, doctor.
I'm Dr. Rashid.
Okay,
How,
okay.
how can I help you today?
Yes, doctor. So don't you think, Dr. Rashid, now it is better than before?
Yeah, it looks better.
I think everybody understood it. So all of you please do it. Not
Yeah.
like a machine. I observed many times, but I was busy with correction of other issues in your consultation. The
Uh-huh.
core material, center, knowledge, and other. Further, I didn't tell before. So today also your last day with me. So far I can understand. So this is the
Yeah,
time to correct even this thing also. How to start? Because the first sentence should be impressive to the examiner.
right.
Is not it?
Mm.
The morning shows the day, right? Like that.
Mm-hmm.
So that's all for you. And now I think we can, Dr. Munir also and Dr. Goul not raising the hand. I think they are happy.
Doctor, I wanted to ask one
Please,
question.
please, please.
Doctor, in this case, suppose like where we have to check especially the lower limb for the some neurological examination, I don't get any like idea. Like you told me now some things, so I'm happy. So what is the focused examination? Because like it's lengthy examination, I feel. So
Yes.
how we can do focused one? What things we should must do and what things we can, even if we don't have time, we can skip?
Focus examination always will be variable. It will be a matter of creativity in your chamber. It is not that whenever I find any leg problem that I have to go for the complete neurologic examination. It will not be a focus. It will be a total examination. But in the GP exam, it is expected that it will be focused. Suppose in this case, weakness. What is the gross idea? Upper motor neuron lesion, lower motor neuron lesion.
Right.
Is that it? So what will be the core feature? Plantar response.
Okay.
This is the very minimum. And even you have seen also in your training period in the hospital, our teachers are coming and only scratching the sole by the key.
Yeah.
Can you remember? I remember.
Yeah, I remember.
They are doing nothing. Nothing. Unfortunately, they are not teaching also this thing. I can remember, but they are doing only plantar and the extensor. Okay, this is a stroke. Do the manage like that, Finish.
Right.
That's called the focus examination.
Okay. Right. So in this case, if we do plantar reflex,
That's enough.
One knee jerk, that is required.
Suppose if you are confident from the plantar response, what will the knee jerk will do for you? Your identification is the cord compression, right?
Right.
So even you cannot correlate the cord compression. You are thinking that there is something serious.
Right.
So it is not your job to identify which level of the cord is important. It is not your job.
Okay.
So these jerks actually identify the levels of the cord damage. The lumbar area or the sacral fiber or other spinal cord segment. It is not your job. What you will do by identifying the level? You are not doing the neurosurgery or something in the chamber. Your job only to identify the something red flag here. You refer the case. Okay.
But for the like because they are testing us for the exam purpose, like they want to see that what clinical examination we are doing when they perform a relevant clinical. That's why I'm asking.
In the checklist, usually will be written that focus examination.
Yeah, right.
So in my sense, in my position now, what I understood, I am commenting. But if anything, something different written in the Royal College sheet, I will tell that it will be unfortunate for the candidate. And something may happen also. What they are thinking, so it may be a matter of argument.
Right.
Suppose as a learner from me now, if you understood my logic, so you have to accept it. Is that it? That is the thing. That is the thing.
Yeah.
Suppose I will not tell that detail because the time is going. You need to
I understand.
I can talk another time. Thank you very much. Thank you.